Hi there. If you're here for this Medicare webinar, then you most likely are about to age into Medicare and you're wondering what steps do I need to take to learn all this stuff about Medicare. Well, let me tell you, it is a journey and a half really, and that's why we created the T65 Your Compass page, and that's why this presentation exists. I'm here today, Jackson Taylor with Brock Partners, to teach you about Medicare and everything you need to know from a high level view so that you can understand it a little bit better, and then hopefully you decide that you want to use Brock Partners for all of your Medicare needs so that we can assist you through this journey with our compass. Enjoy the webinar. So today what we're going to be talking about is how to make the right Medicare choice for you. We're here to help you make the right Medicare choice. At Brock Partners, Brock Insurance, we thrive on helping people make the right Medicare choice, and we've been doing that for a long time. And so we're going to go through this presentation, and what we're going to do today, we're going to cover a couple of different topics. We're going to cover the Medicare basics, Medicare supplements, Medicare Advantage plans, prescription drug coverage, and important dates and more. We're going to talk about all of these things in this presentation. Now, I do need to let you know that today in this presentation, I'm going to give you a high-level overview of all of these things. I'm going to give you the nuts and bolts, if you will. If I gave you every little detail of everything, we would be here for hours. And I know that you don't have hours of time to watch this presentation, but I am going to give you a high-level overview, and I am going to do it in a way that's going to educate you in a way that maybe you have never been before with Medicare. So we're going to talk about these things, and I'm going to do my best to give you some insight that maybe you have not heard yet, because I know that you are currently getting all these emails, all these phone calls, all these letters in the mail, and you're seeing all these commercials talking about Medicare this, Medicare that, Medicare this, Medicare that, and everyone has an opinion on what direction you need to go, but they don't actually sit down and explain how all this stuff works. So today, what I'm going to do is I'm going to explain the basics of Medicare. I'm going to explain Medicare supplements, Medicare Advantage plans, prescription drug coverage, other things that you need to consider. I want to make sure that we go over these things in a way that you feel confident you can make the right Medicare choice for you. Now, before I get into all of these topics about Medicare, I do want to talk about why it's important that you have proper health insurance. You can see here on the slide that we're on that the cost of health care in retirement is concerning. It is estimated by 2028 that seniors, people in retirement, will be spending $6.6 trillion in healthcare, which is an astronomical number. I mean, I can't even really wrap my head around how much that is. That's a 5.4% projected annual growth in healthcare spending from 2019 to 2028. Now, what does that look like on a graph here? Well, if you take a look here from 2011 to 2021, overall inflation rose 2.4%. So inflation on average was at 2.4% in that decade. Inflation rate for healthcare was at 2.8%. Well, look at this. Premium for family insurance grew 47% in that decade. Why am I giving you this information? I want you to understand that the cost of healthcare and the cost of insurance is high. It has grown at a ridiculous rate. And it is important that you understand the climate of healthcare and health insurance so that you can make a decision for you, especially when we're talking about retirement and you're going to be most likely on a fixed income and you're wondering what this looks like. It all feels like a mystery because you're retiring and this is new. You've been on the same health insurance for years and years and years, and now all of a sudden this is new. We have to make sure that you are in a spot that will take care of you and your family. And so where does this begin? What is Medicare? We need to understand what Medicare is. We need to start with that. What is Medicare? Well, Medicare is the largest health insurance program offered by the U.S. government, serving nearly 64 million people as of October 2021. And it has only grown since then. About 10,000 people age into Medicare every day. 10,000 people in the U.S. a day are turning 65, meaning that they're aging into Medicare. So it's only grown since then. Those are just the official numbers that we have since 2021, 64 million people. I do say it's the largest health insurance program offered by the U.S. government. Well, we have three, right? We have three health insurance programs or three main health insurance programs that are offered by the government. That is Medicare, Medicaid, and then the third one's not offered by the government, but it is subsidized, and that is the Affordable Care Act. And some of us know that as Obamacare. But Medicare is by far the largest one. Medicaid is right under it, but there's a pretty good gap there. It's run by Centers for Medicare and Medicaid Services, also known as CMS, part of the U.S. Department of Health and Human Services. So this is an official program or funded program by the U.S. government. It's federally regulated. And Medicare is divided into four parts. Medicare is divided into four parts. And you'll see here that I have two green boxes and I have two black boxes at the bottom. And the reason for that is Part A and B, our first two parts of Medicare, are kind of found together. And what I mean by that is Part A and B is what we call original Medicare. That's original Medicare. When you get your red, white, and blue card in the mail, it's going to come in and it's going to say Part A, hospital, and Part B, medical, meaning that is your health insurance, that red, white, and blue card. And Part A of Medicare is going to be your hospital coverage. Part B is going to be medical. And I'll explain what that means in just a moment. But those are going to come together and make up original Medicare. And those are your first two parts of Medicare. And then we have Part C, which is Medicare Advantage. And I know you have heard about Medicare Advantage. It's the most well-marketed product on the earth. Everybody has heard about Medicare Advantage. You've heard this opinion, that opinion. It's a very well-marketed product, but it is something we need to talk about today because it can be very beneficial, just like original Medicare can be beneficial. And then we have Part D, which is prescription drug coverage. Makes it pretty easy. Part D stands for drug coverage. So I have Part A, hospital, Part B, medical, Part C is Medicare Advantage, and then Part D is prescription drug coverage. So that's your ABCD of Medicare. Moving on, original Medicare. I just mentioned that original Medicare is made up of Part A and Part B. Part A being hospital and Part B being medical. Part A is your hospital coverage, meaning that Part A is what's going to kick in and cover your hospital stays. If you were to have room and board, if you stayed at the hospital or a skilled nursing facility, or you were placed in hospice or somehow had some kind of home health care that you had to pay for, room and board is kind of what we describe that as. That is a good rule of thumb when you're thinking about Part A. Part A is going to foot that bill. And then you have Part B. Part B is going to cover medical, and that's what's going to kick in on all of your medical services, especially, we're thinking outpatient here, but that's what you're going to primarily be using insurance for. Doctors, and specialists, we're seeing that a lot more than having hospital stays or skilled nursing visits. So this is what we use most of the time. It's going to cover things like doctor's appointments, outpatient care, occupational and physical therapies. So this is what's covering your medical services. This is what foots the bill. Those two things those two parts of Medicare make up original Medicare, Part A and B. And it will literally be on your red, white, and blue card, Part A, hospital, Part B, medical, and they'll have effective dates beside that and everything. And then we have Part C, again, that is Medicare Advantage. And these two options here are both offered by private companies. I need to start by, both of these by saying that they're offered by private companies. I go back here to Part A and B. These are offered by the federal government. These are offered by private companies. Part C covers everything that Parts A and B covers. So there is kind of a common misconception that if I were to enroll into a Part C Medicare Advantage plan, that I would be giving up my Medicare. That is not the case. Now, Medicare Advantage is a replacement plan for original Medicare, but it's still primary Medicare health insurance, and it is going to cover everything that Parts A and B of Medicare cover. It has to. That is a federal regulation that it has to cover everything that Parts A and B covers. It's just a replacement plan. It doesn't get rid of your original Medicare. It replaces it, or really a better word to understand how it works is it really restructures it. That's how I would look at it. It often covers additional services like dental, vision, hearing, wellness programs, and it often includes a drug plan in it without having to get an additional one. And we'll talk about that more in depth. And then Part D covers prescription drugs, but it is offered through a private company. Let's find out who's eligible for Medicare. Well, if you're watching our seminar, if you're watching this presentation, then you probably are turning 65. 65 is when you're eligible for Parts A and B of Medicare, even if you still work. So one common misconception is if I'm going to continue to work, then I don't need to get Medicare. If I'm not going to retire, I don't need Medicare. That's not necessarily the case. You can continue to work, and maybe Medicare is a better health insurance option than what your employer coverage is. And if that's the case, well, then you should elect to go with Medicare. And we help customers with that all the time. We like to weigh things like premiums, deductibles, copays, all in between. I mean, everything you can think of, co-insurance. We like to weigh those things to see what direction is really going to be right for you. What you need to know, though, is that 65 is when you're eligible no matter what. You become eligible for Medicare. There are other ways to become eligible, but 95% of the customers that we have helped at Brock Insurance, are people who are turning 65, and they become eligible for Medicare because they're turning 65. Another common misconception is that people think I have to wait until I start drawing Social Security. So what if I want to start drawing Social Security at 67? Do I just wait then? Well, not necessarily. You can go ahead and enroll into Medicare's Part A and B without enrolling into Social Security. You don't have to do either or you don't have to do them together. You can do either or, rather. And so that's something that a lot of people ask us all the time. Do I have to wait until I enroll into Social Security? No, you can do this right now and then enroll into Social Security later. You can also become eligible for Medicare through your spouse, although you still must qualify by age or disability. And I like to really highlight that word disability because we've already discussed that turning 65 is our most common route to becoming eligible for Medicare. Well, what's the second most common route? That is disability. Maybe you're watching this and you are becoming Medicare eligible, and you're thinking to yourself, well, Jackson, I'm not turning 65. Well, maybe you've been on disability for 24 months or longer. If you have been officially on disability, drawing disability for 24 months, then you will become eligible for Medicare if you were to apply for it. At least 24 months, so 2 years. It has to be at least 24 months, and maybe you've been on disability for 2 or more years. And if that's the case, then you are eligible for Medicare, even if you're 28. I mean, I have customers who are as young as 28, 30, 31. And they are on Medicare because they're disabled. You may also qualify for Medicare Parts A and B if you're under 65 and have, again, a disability, or you have been diagnosed with end-stage renal failure. That would also open up eligibility for somebody for Medicare. Automatic enrollment for Part A and Part B. How hard is the process to enroll into Medicare? Well, the good news is if you are drawing Social Security benefits, the hard part's over. You will automatically be enrolled. So if you're already drawing Social Security, then you will automatically be enrolled into Medicare Part A and B. And the way that would work is you would receive your initial enrollment period package, which is mailed 3 months before turning 65. So if you're 3 months out from turning 65, then you are most likely going to get a package very soon, if you haven't already gotten it, that has your initial enrollment information in it. It'll have your Medicare card, like you see on the slide here. It'll have information about Medicare, your premium that you'll pay for Part B, and the level that you're at there. If you're already drawing Social Security benefits, or you're already enrolled into Railroad Retirement Board benefits, then you will automatically have that done. Now, don't worry if you're not already drawing Social Security benefits. If you're not already enrolled into either one of those, you can still apply for Medicare, and you can still get enrolled very easily. The easiest way to do that is through ssa.gov. But the good news is we have plenty of team members here at Brock Insurance that can help you with that and make that process even easier. And the good news is, using Brock Partners, this is the hardest part. This is going to be the hardest part, and it's easy. Everything else we can take care of for our customers. We take care of for our beneficiaries, and we even help with this if that is something that needs to be done. My Medicare initial enrollment period. This is where it all starts. This is where everything begins for a Medicare beneficiary. And this is going to be the 3 months prior to turning 65. 3 months prior to turning 65. Let me explain how this really works. We call this IEP in the industry, in the business, but initial enrollment period is what it stands for, IEP. And this is a 7-month window. 7-month window. This is the time frame that I can enroll into Medicare A and B, Medicare Part C, and Medicare Part D. So I can enroll into Parts A, B, C, and D in my IEP. It's a 7-month window that starts 3 months prior to turning 65. And then it includes the month in which you turn 65, and then the 3 months after turning 65. So 3, 1, 3. 3 months before turning 65, the month of turning 65, and then 3 months after. It's important to note that your Medicare effective date is always going to be the first of a month. It's always going to start on the first of a month. It's not going to start necessarily on your birthday. It will start the first of the month. And it's going to be the first of your 65th birth month unless you were born on the first. We'll talk about that in a moment. So this actually starts the first of the 3 months prior to your 65th birth month. So it's not your birthday, it's your birth month. So 3 months before your 65th birth month, the month of your 65th birthday, and then the 3 months after that. If you retire after 65, enrollment depends upon when your employer-sponsored coverage ends. And so you would have to use a different enrollment period other than IEP, depending on if you activated Part B or not. And then newly qualified due to disability. If you're qualified due to disability, then you would get an IEP too that is not based on your 65th birth month. Now let's talk about what original Medicare looks like, what you'll pay. With original Medicare, you will pay a share of the cost. And when I say the cost, I mean your services, hospital, medical. You will be responsible, just like any other health insurance, you will have a cost share. And when I say cost share, what that means is that the insurance has a share of the cost, and then you as the beneficiary have a share of the cost. And with original Medicare, it's no different. You will have a share of the cost. And I'll go ahead and tell you, there are some cost shares. There are some gaps to the coverage that we're going to talk about that concern us and can be quite alarming. And I want to preface that so that you don't watch this next slide, you don't see this next slide, and your eyes pop out of your head. I want you to see this and know this, and know that the reason that we exist, the reason Brock Insurance exists, is because we're helping customers avoid these out-of-pocket costs. But let's talk about these. So with Part A, what are we looking at? First things first, as long as you've worked 40 quarters, which is 10 years or more, or even your spouse has worked 40 quarters or 10 years or more, your monthly premium for Part A is going to be $0. $0 is what you're going to see for Part A premium. Now, I do not use the word free, and here's why. You already paid for it. It wasn't free. If you paid taxes while working for 40 quarters or 10 years or more, or your spouse has done it, then you've already paid for it. That's why you see that Medicare tax on your check stub. You see that Medicare tax? You have been paying for your Part A insurance the whole time that you have been working. So now you have a $0 premium, which is great. Now, if you did not pay taxes, maybe you had a job that you didn't have to do that, or maybe you're an immigrant, you moved here recently and got your citizenship, and now you're going to Medicare. There are premiums associated with that, but most people do not have premiums for Part A. We're going to talk about the higher premiums in a moment, but it is important to understand that 99% of the people I help have $0 Part A. Their Part A premium is $0, and so they don't have to pay that. So I wouldn't look into it too much, but if you think that is something that you would end up having, maybe you didn't work those 40 quarters and you're concerned about that, that is still something we can help with, and we'll talk about at the end of the presentation how you can get in touch with one of our advisors, one of our specialists, Medicare specialists, and they can tell you how this kind of works, one of our Medicare advisors. But I do have a deductible. So on Part A, I do have a deductible, and that is a $1,676 deductible. Now, you'll also see there beside it, it says benefit period. Let me explain. Most deductibles, especially the ones that you've been used to, the coverages that you've had your whole life, the deductible is annual, meaning that it resets every January 1st. Your deductible resets. If you met that at the beginning of the year, then you're done. You don't have to pay it again until the next year. With Medicare Part A, that benefit, that deductible, does not reset at the beginning of the year. It resets every benefit period, and that is 60 days after you paid it that first time. So let me explain. If I go to the hospital, I will pay the first $1,676 out of my pocket because that's what a deductible is. It's the amount that I have to pay before my insurance will pay anything. So with Medicare Part A, I have to pay that $1,676 up front before Medicare Part A will pay anything. That's what I have to pay up front. And if I were to go to the hospital 60 days later and it was not related to that first hospital visit, I could pay that again. Right? And if we do our math, that means I can technically end up paying that up to 6 times a year. So that's something you need to pay attention to. Hospital copays. After I meet my deductible, for the first 60 days, I don't have to pay anything else, which is very nice. However, if I were to stay in the hospital for days 61 through 90, my copay goes to $434 a day. $434 a day. This is when most people's eyes start to get really big. This is part of the presentation. Days 91 through 150, if I were to stay in the hospital that long, it is an $868 copay per day. That means I will pay $434 a day out of my own pocket for days 61 through 90. And then 91 through 150, I would pay $868 a day out of my own pocket. You can do some math. That adds up really, really quickly. It can be thousands and thousands and thousands of dollars. And then after day 150, if I were to stay in the hospital longer than 150 days, all of a sudden now I'm going to pay 100% for my hospital visit. Each day after that, I'm paying for it completely out of my pocket. And if you know anything about the hospital, those can be $5,000, $6,000 a day for each day. Skilled nursing. This falls under Part A. This is how this works. If you're on Medicare and you're covered by Part A, days 1 through 20, I don't have to pay anything. That's covered. Now, I do have my Part A deductible that I have to pay, but as long as I paid that, days 1 through 20, I won't pay anything else. Days 21 through 100, I now have a $217 copay per day. $217 copay per day for days 21 through 100. What that means is that Medicare is going to cover my first 100 days, 1 through 20. It'll be covered completely. Days 21 through 100, I would have to spend $217 a day out of my own pocket. Again, that can be thousands and thousands of dollars. After 100 days, it now will be the customer, the beneficiary's full responsibility, meaning that if you stayed in the skilled nursing facility more than 100 days, you would pay everything out of pocket from there on out completely. Medicare would not pay anything else. So you can see right away, we hadn't even gotten to Part B. Just on Part A, Original Medicare, there's a ton of out-of-pocket costs that you can have. There's a lot of gaps that you're not shielded from, that you're not protected from. It can be very concerning. That takes us into Part B. First things first, the monthly premium starts at $202.90, and 90% of Medicare beneficiaries will be paying that $202.90. Most people will pay it, but it can cost all the way up to $689.90, and that's based on my income. So there's a chart that we'll look at after this that shows that. If you make a higher income, that can go up. That can be higher. But most people do pay that $202.90. That is really considered normal. Most people that pay that $202.90, I can count on two hands how many customers I have that pay more than the $202.90. But we will take a look at that. It can be higher. My Part B deductible, you can see here, is $283 a year. So it's lower than the Part A deductible, and it is annual, which is much better, right? We had a benefit period on Part A. Well, with Part B, we have a $283 deductible for the year, meaning that once I meet that for my medical services, that's met for the year. It will reset next January. I don't have to worry about benefit periods with that one. Now, the most concerning out-of-pocket cost with any Medicare coverage at all is right here. It's this Part B coinsurance. And this is the one that you most likely have heard about when you hear people say that 20%. With Medicare on Part B, I have an 80-20 coinsurance, which means that Medicare pays 80%, and the beneficiary, you, will pay 20%. 20% of all your medical services. That doesn't sound too bad. You're used to that. You've been on employer coverage, and employer coverage has coinsurances. However, your employer coverages also have max out-of-pockets. Neither Medicare Part A or Part B has a max out-of-pocket. So what does that mean, Jackson? Well, that means that if I go to my doctor's office visit and it's a $100 visit, well, I'm going to pay $20. I'm going to be responsible for $20. Not bad. If I have a $100,000 heart surgery done, I'm going to be responsible for $20,000 of that surgery. If I have $1 million worth of heart surgery done, which can happen, we've seen it before, I would be responsible for $2 million because there's no stop loss on Medicare. You work your whole life for it, you pay your taxes for it, and they can't even put a max out of pocket on there. That's why we exist. That's why Brock Partners exists, why Brock Insurance exists, because we want to help customers just like you avoid paying these out-of-pocket costs. We want to shield you from these out-of-pocket costs, and we can do that in a way that takes great care of you and fits your budget. That's what we're going to focus on. Now, before we jump into all that, I do want to take a look at the Part B IRMA, the income-related monthly adjustment amount. This is the chart I was talking about. This is how your Part B could be increased. This is the income levels that can be increased. Most people are going to be on that first level, that 202.90. And you can see that the chart says here individual tax return is $109,000 or less. So if you're by yourself, if you're individually filing tax, you're not doing it joint or married, you're just doing it on your own. If you're in that range of $109,000 or less a year, then your Part B premium would be $202.90. If you're filing joint, then it's $218,000 or less that you and your partner would be at $202.90. Or if you're married, it's $109,000, and you're filing separately, it's $109,000 or less, right? And then you'll be at $202.90. So you can see there, I'll make it even simpler for you. If you're filing by yourself, whether you're married or not, $109,000 or less is that first level. If you're filing together with your spouse or with a partner, you're looking at $218,000 or less to be at that $202.90. The next level would be $109,000 to $137,000 as an individual. That would take you up to $284.10 for your Part B premium. And then we have filing joint, $218 and $1 all the way to $274,000. Again, that would take you to that $284.10. And this is a good one. I'm not going to go through each level here, but you can take a moment. I'm going to take a moment and talk about this. You can find what level of income you are filing at, and then you can kind of match it to that Part B increase right there that you see. You have $202.90. Level 2 here is $284.10. Level 3 is $405.80. Level 5 is $527.50. Then we go to $649.20, and then our highest level is $689.90, which would be filing at $500,000 plus a year as an individual, or $750,000 plus a year as a joint filing. Some things to consider. Most people do fall in that first one, but maybe you are in that next one. And if you're unsure, again, we're going to talk about how you can get in touch with one of our Medicare advisors so that we can discuss this. Your Medicare options. How do I avoid these out-of-pocket costs that we just went over? You're thinking to yourself, Jackson, there's no way I can go to Medicare. I'll be broke if I have to spend all that. Me too. I would be too. And so I don't want you to feel that way. I don't want you to have to worry about those out-of-pocket costs. We want to shield you from those out-of-pocket costs. How do we do that? How do we shield you from the out-of-pocket costs? Well, we're going to talk about for the next few moments the two directions that we can go to shield you from that out-of-pocket cost. First, we're going to talk about original Medicare, Part A and B. Maybe you're in that group that says, hey, I want to stay on Part A and B of Medicare. I don't want to go to Medicare Advantage. Completely understand that. We want to service those people, and we make sure that we have the products to do so. But if you're going to stay on original Medicare, we do not advise staying on just original Medicare. That's why I was showing you all those out-of-pocket costs. What we typically do there is we get a Medicare supplement insurance from a private company, and then we have to purchase a Part D standalone prescription drug plan from a private company. So if we go that direction, then there's two different products that we have to make sure we enroll you in to get you adequate coverage. So we're going to take a look at that. And then the other option is Medicare Advantage, which is Part C from the beginning of the presentation, if you remember. We talked about Medicare Advantage Part C. Medicare Advantage from an insurance company, which includes Part A and Part B. These plans often include prescription drug coverage as part of the plan, often have you pay the Part B premium in addition to a Medicare Advantage plan premium. So there's two ways that we're going to talk about shielding you from those out-of-pocket costs. How Medicare Supplement helps cover original Medicare costs. What is a Medicare supplement? In order to find out how it's going to help, we have to talk about what a Medicare supplement is. Unlike original Medicare, a Medicare supplement plan is funded by individual policies offered through a private insurance company. Insurance companies are required to offer the same basic benefits for each lettered plan, though they do have the ability to charge different premiums. Let me break that down even further. Medicare supplements do exactly what the name of the policy says it does. It's a supplement to Medicare, so it supplements your Medicare. If you elect to stay enrolled into Part A and B, original Medicare, a Medicare supplement is going to come in as a secondary to pick up the gaps for you, to shield you from those gaps. Now, they are offered through private companies, so these are not federally regulated. However, there are certain regulations that come in and make sure that these plans are standardized. We like to use the term MACRA, passed in 2015. It was an act passed in 2015 that standardized these plans. So a plan G has to be a plan G, no matter what carrier we go with. A plan F has to function like a plan F, no matter what carrier we go with. And a plan N has to function like a plan N, no matter what carrier we go with. Medicare supplement plans help cover the gaps in original Medicare. It's going to cover the things like coinsurance, yearly deductibles, and the co-payments. That's what it's going to do. And so we're going to take a deeper look into each one here. You can see here I have a list of Medicare supplement plans, a whole list of them. We already talked about Part A, B, C, and D, and now I've got plans A, B, C, D, F, G, K, L, M, N, X, Y, Z, L, M, O, P. It's a lot of different options in there. You can see that it can be a little overwhelming when we start looking at that. That's why we're going to focus on three. We're going to focus on three. And I'm going to get to those three in a moment. But I really want to talk about the Plan G. I want to give you an idea of how this works. It's going to fill in the gaps here, how these are going to shield you from those out-of-pocket gaps. So if you were to purchase a Plan G, which is the most popular Medicare supplement in the U.S., this is how it would work. This is my chart from earlier that showed the out-of-pocket cost for Medicare. This is how a Plan G would work. Now, these costs are based off 2024, but I'm just showing you how this is going to fill in those gaps for you. We talked about your Part A deductible. With a Plan G, it's going to eliminate that. In other words, Plan G is going to cover that Part A deductible for you. Every benefit period. I mentioned that the Part A benefit or the Part A deductible resets, it's going to pay it whether you go, if you had to pay it 6 times a year, it's going to pay it every time. It's also going to completely pay for every hospital service that you have after the fact. Let me go back. I skipped ahead of myself there. It's going to completely eliminate the hospital and skilled nursing copays that we talked about earlier too. And then what you're really going to love is that Plan G is going to eliminate or cover, rather than eliminate, it's going to cover and pay your 20% on medical services. So on Part B, we talked about that 80-20 coinsurance, your responsibility being 20%. Plan G would pay that completely. So the only out-of-pocket cost that I have on either Part A or Part B when I have a Plan G is that $283 deductible on the Part B deductible. Now that, of course, changes each year. You see $257 right here. That was for 2024. So that Part B deductible can fluctuate, but Plan G is going to cover it no matter how much it costs you. Plan G would cover everything else except for that Part B deductible. And so it gets rid of that 20% completely. So let's think about this for a moment. Let's say I'm going to Medicare for the first time in 2026 this year, and I have a Part B deductible of $283. With a Plan G, technically now my max out of pocket is $283. Why? Because original Medicare is going to pay its share. Plan G is going to pay my share outside of that Part B deductible, meaning that I have a max out of pocket on hospital and medical of $283, which is much, much more reasonable than those out-of-pocket cost numbers I was giving you earlier. It can be very, very beneficial. Medicare supplement enrollment periods. Medicare, we talked about earlier, Medicare's Part A, B, C, and D. They have their own enrollment periods. Medicare supplement also has its own enrollment periods. First, we need to talk about the open enrollment period. This starts the month of your Medicare Part B effective date and lasts for 6 months. You're guaranteed issued regardless of health status. So let me explain what this really means, your open enrollment period. I can start enrolling into a Medicare supplement plan 6 months before my Part B effective date. 6 months before my Part B effective date. It's a 12-month window that starts 6 months before my Part B effective date or my 65th birth month. That's how the open enrollment works. So I can start enrolling into a Medicare supplement plan well before I even enroll into Medicare. I don't technically have to be enrolled into Medicare to go ahead and put this in place. That's why we tell customers all the time, it's not too early to start looking at this. If you're a year out, then you need to start learning about these Medicare supplement plans, because it may be a very viable option for you. And you need to talk to an advisor about what that looks like for you and what the experience looks like for you, so that you can start deciding, maybe this is the way I want to go. And then you can enroll prior to that, so that we make sure we have all our I's dotted, our T's crossed, and that the carrier doesn't have any delays on your coverage, right? So that starts your open enrollment period. And then I have special enrollment periods. Really, I have a guaranteed issued right. What that means is maybe I have been on Medicare already. I don't have an open enrollment because my Part B's already been effective and I'm leaving employer coverage. Well, in that situation, I still get a guaranteed issued where I get to enroll into a plan with no underwriting. It's also important to note that the open enrollment period, I don't have to open it. I don't have to answer any kind of underwriting question. If I have cancer, if you currently have cancer right now, you would have to automatically be enrolled into a Medicare supplement plan. They would have to let you get that coverage if that's what you want to do. They would have to let you have that coverage despite what your health looks like, regardless of your health status, which is very beneficial. Now, here's why it's important to do this in a timely fashion. Outside of the enrollment period, must pass medical underwriting, no guaranteed issue from the insurance company. So if you don't get enrolled into a Medicare supplement plan within that open enrollment or the guaranteed issued, well, all of a sudden you have to pass underwriting. And if you have something like cancer, major heart conditions, or maybe you are diabetic and taking insulin, those are types of medical conditions that can keep you from being qualified for these Medicare supplement plans. So it's very vital that you get this done in a timely fashion and you talk to an advisor who gets you enrolled in a good, timely manner, and make sure that you get everything done in that open enrollment period. And that's something that we do at Brock Insurance. We make sure our customers get enrolled in that time frame. We do it very efficiently, effectively, and we always advise looking at this. If you're a year out from Medicare, you need to be looking at this and being prepared, and you need to be talking to an advisor so that we can start talking about what's right for you and get all this done in a timely fashion and have no delays. We don't want to miss this, and then all of a sudden you have to pass underwriting and you do not qualify for a Medicare supplement. How does Medicare Advantage help cover original Medicare cost? Well, again, unlike original Medicare, a Medicare Advantage plan is funded by individual policies offered through private insurance companies. Benefits for Medicare Advantage plans vary in several ways. Although many plans have low monthly premium, you are responsible for several costs. A Medicare Advantage plan, let me break it down simply, is a replacement plan. This becomes your primary insurance through a private company. It still has to cover everything that original Medicare covers. And the way that's going to help cover your gaps is it's going to restructure. Instead of having an 80-20 co-insurance for everything, now you have a copay structure with a few co-insurances in there. You have a yearly deductible, but most importantly, you have a maximum out of pocket with Medicare Advantage plans. These Medicare Advantage plans give you a maximum out of pocket. And this does say a low premium. Typically, it's going to be a $0 additional premium. Medicare supplements, you have to purchase those, and they have a premium. So I have to pay for Part B, I have to pay for the supplement, and I have to pay for a drug plan. All of a sudden, I'm paying for lots of insurance. With a Medicare Advantage plan, I can get a max out of pocket. I can get dental, vision, hearing. I can get other benefits without paying any additional premium. That's why a lot of customers love this route. Staying inside of a network and doctors of hospitals. So with Medicare Advantage, you will have what we call managed care, which means that I have networks, I have authorizations that I have to deal with. So there's several things to consider. And this is just kind of like option two. This is just a little chart showing you what it looks like. Medicare Advantage, option 2, choose a Medicare Advantage plan. It's offered by a private company, combines Part A and B into one plan, usually includes prescription drug coverage at no extra cost, and may offer benefits like dental, vision, hearing, even gym memberships. And it often includes things like over-the-counter coverage. It has lots of extra benefits, can be very beneficial. This is more of our bang-for-buck option that is managed care. It looks a lot like employer coverage, I'll put it that way. Now, some important dates that you need to remember going forward. October 15th through December 7th. This is the annual election period for Medicare Advantage plans and prescription drug plans. for the next calendar year, effective date January 1st. Here on out, if you elect to enroll into a Medicare Advantage plan or a prescription drug plan through Part D, going forward, the only time of the year that you can make a change just freely without some kind of special enrollment period or some kind of life-changing event would be October 15th through December 7th. This is the open enrollment period, is what some people maybe would like relate it to if you're thinking like employer coverage, but we don't call it that because our next one is called that. But the annual election period is the time frame, the window each year, October 15th through December 7th, that I can make a change to my Advantage plan or my drug plan for January 1st. That's every year, and that is when you can make those changes. January 1st to March 31st, this is what we call open enrollment period. This is what we call the open enrollment period, but it used to be called the annual disenrollment period, meaning that if I wanted to disenroll from my Medicare Advantage plan, I could do it this time of the year. During this time of year, January 1st to March 31st, I can make a change from a Medicare Advantage plan. I can't just freely change from Part D. So if I'm on a Part D plan, I can't go from Part D to a Medicare Advantage, or I can't change from Part D to another Part D or drug plan to another drug plan. But if I'm on a Medicare Advantage plan, I can disenroll. I can go from Medicare Advantage or prescription drug coverage, Part D plan, or I can go from Medicare Advantage plan to another Medicare Advantage plan. This is the one that we call open enrollment. So even though the AEP, the annual election period, feels more like open enrollment, this is what we actually refer to as open enrollment. Medicare Supplement versus Medicare Advantage. Monthly premium. Medicare Supplement, you will have a monthly premium. That is going to be a convenient option, but it is going to cost you more, and that is for sure. Medicare Advantage plans, the premiums are low, often zero. And you can't get much lower than zero. I would say the only way they'd be lower than zero is if they give you money. The fact is, some of these Medicare Advantage plans will give money back. They will reimburse you on your Part B. That is definitely true. So it is definitely your lower cost option. Includes Part D, dental, vision, and hearing. Medicare Supplement plans do not include Part D, and they do not include dental, vision, and hearing because Medicare does not cover those things traditionally, and your supplement plans only going to cover what your Medicare covers. A Medicare Advantage plan, this says sometimes, actually most of the time, these Medicare Advantage plans do include Part D at no extra cost and dental, vision, hearing, as well as other benefits at no extra cost. Co-payments to providers. With a Medicare Supplement plan, if you went Plan G, you're not going to have to pay a whole list of different co-pays. If you go Plan N, you could, but a Plan G, you're not going to pay any co-pays. You're going to pay your Part B deductible, and then you're done. You don't have to worry about anything else. With a Medicare Advantage plan, you will pay co-pays. That's the structure of a Medicare Advantage plan, is the co-pays. Up to a $7,500 out-of-pocket cost. Medicare Supplement plans, you do not have to worry about a $7,500 max out of pocket. Though that is a benefit, a Medicare Supplement plan is going to cover everything, Plan G specifically, everything except for your $283 deductible, meaning that my max out of pocket is going to be $283. On a Medicare Advantage plan, $7,500 is the average maximum out of pocket on a plan. That is a great benefit. It's a fantastic benefit because original Medicare by itself has no maximum out of pocket. So at $0 extra dollars a month in premium, I can get a max out of pocket of around $7,500. What that means is, in a worst case scenario, I could spend $7,500 out of my own pocket. Once I reach that, the insurance will pay everything else. Restricted to networks of doctors and hospitals. Medicare Supplement plans are not restricted to networks. If a doctor or a hospital takes Medicare, which 99.9% do, then they have to take my Medicare Supplement plan no matter what carrier it's with. A Medicare Advantage plan, I have to consider doctors and hospitals being a network. The good news is at Brock Insurance, we have the tools necessary to find that out for you. We can plug your doctors and hospitals in, and it will literally tell us what doctors and hospitals your doctors prefer you be on, what plan your doctors and hospitals prefer you be on. So we can make sure that we do that. But you are restricted to doctors and hospitals most likely. Can I appeal coverage Medicare decisions to Medicare? With the Medicare Supplement, I can. Medicare is the one that makes those decisions. With the Medicare Advantage plan, yes, I can. I can still appeal coverage decisions of Medicare. Either direction I go. Choosing what's right for you. I wish I had a crystal ball to tell you exactly what direction you needed to go. I don't. The only way to really tell you what direction you need to go is to have a conversation. And we have tons and tons of agents over here that can help you. We've trained these agents, and they are very qualified. We do not operate in a way that we just put agents out there just to do it. Our agents are trained every day to have conversations and to have talking points and fact finding that helps you find a plan that's going to be right for you and your family. I have to have a conversation. Everybody's different. Half of Medicare beneficiaries go Medicare Advantage. Half of the others go Medicare Supplement. And so how do I just put that out there and say this is what's best for this person, this is what's best for that doesn't exist. There has to be a conversation. And at Brock Insurance, we are the advisors that want to talk to you and have that conversation in a way that's going to set you up for success on your Medicare journey. Part D, just to lightly go over this, Medicare Part D is an optional prescription drug benefit program intended to help Medicare beneficiaries reduce out-of-pocket drug cost. In other words, if I want drug coverage, I have to purchase either a Part D plan, a standalone Part D plan through a private company, or I have to enroll into a Medicare Advantage plan that has Part D coverage. And the good news is that once I enroll into a drug plan, I only have a couple different out-of-pocket costs for my drugs that I may run into. First things first, I have a deductible. And in 2026, that deductible for drug cost can be anywhere between $0 to $615. $0 to $615. That's the range that my deductible can be at. After that, I have a $2,100, what we call MOOP, but it really is a troop, but just for the simplicity of this conversation, this presentation, we'll call it a MOOP, a max out of pocket. I have a $2,100 max out of pocket, meaning that $2,100 is the most I'll spend for my drugs. Now, the most important thing here that you need to understand is I have a $2,100 max out of pocket, which is very, very beneficial. That's great. That's the most I'll spend on my drugs if my medicines are covered. So I have to make sure I get on a plan that covers my medications. My medications are in that formulary. And I have to consider things like, futures of this kind of medicine, that kind of medicine. And so you need to talk to an advisor that knows their stuff about this so that you get on a plan that's going to cover your prescriptions so that you do get that $2,100 max out of pocket and that your medicines are covered. Nothing's worse than getting on a plan and all of a sudden your medicines aren't covered. No sense in that. So at Brock Insurance, we train our agents to use the tools and the conversation to make sure that we get this in the right place. It's very important that you get that done. Some other helpful resources that I want to let you know about. You always can go to Medicare.gov to see these things. The Medicare and You Handbook, published by CMS. That is something that comes out each fall. Definitely need to take a look at that. It's a very good resource. Also at Medicare.gov, you can find Choosing a Medigap Policy, a guide to health insurance for people with Medicare. That's a very great source. Also, the book that you may have requested from us already, if you haven't, you should. It is the Alphabet Soup of Medicare, the Medicare Breakdown book. That's what we call it, the Medicare Breakdown by Justin Brock. Fantastic piece of literature that can break down Medicare very simply for you on a level that everyone can understand. We're getting here towards the end of our presentation. I want to talk about other things you should consider. Medicare drug coverage has a maximum out of pocket, but that maximum out of pocket is a $2,100 maximum out of pocket. And so those are things that we really want to consider. If you start getting diagnosed with things like cancer, heart attack, and stroke, that can really affect you. When I have conversations about people or with people about retirement, I like to ask this question. I like to say, what types of coverage are you losing? And 10 out of 10 times, they always tell me, well, Jackson, I'm losing my health insurance. I say, well, yeah, I know that. But what about dental, vision, and hearing? They go, yeah, I am losing that. And I say, what about critical illness? They go, oh, wow, I'm losing that. I am, you're right. And I ask questions like life insurance, are you losing that? Yes, I am. And I say things like, well, have you considered long-term care? You're getting older. Have you started retirement planning? Rolling over your 401ks. Are those things that you have already started considering? And a lot of times they have to tell me, no, I haven't planned for any of that. I didn't consider losing any of that. I didn't consider rolling any of my 401k over. I didn't consider my critical illness coverage. All those types of things are things you need to plan for. And at Brock Insurance, what sets us apart is we don't just help with Medicare. We're going to help with Medicare. That's the primary focus. But I also want to help by getting you covered everywhere. and being a one-stop shop for retirement planning. We want to make sure that you have peace of mind with insurance, but have peace of mind with your pocketbook too. So we want to take care of everything so that you don't have to go from person A, person B, person C, person D to figure all this stuff out. Let's just make it easy. Medicare is a journey, and we're the compass. You need to use this like a compass. We can help with every direction. Your next steps. I've given you a presentation, and I hope it's been very helpful and that you've learned. The next steps, Medicare education, our Brock online video content. We have a YouTube page, the T65 Compass. Your 65 Compass is what we call it on YouTube. You should certainly check that out. You can find it on our Facebook page at Brock. You can find it on our Instagram page, our social media pages. You can go to YouTube and just look up Your 65 Compass. We put out content about turning 65 in Medicare every day. We do that all the time, and it's very educational. Today's educational seminar, the presentation you just went through, this is the presentation we do virtually, and we also do it in person. We do this for our local community. We are all about educating, and so you got your education. Step one's done. Congratulations. You've gotten that process done. There's more that you can go find to educate more, but you have already completed step one of the Brock process, the Brock Compass process. Step two is enrollment advice. The next step we need to take is schedule your free consultation to discuss your specific situation and get expert help choosing which plans are right for you in an area of life and circumstance. Receive your bonus item, Quick Guide to Medicare, and your second bonus item, Medicare Breakdown Book, when you set up that consultation. In other words, the next step here is set up a consultation with one of our Medicare advisors. We're here to give you a free consultation on what direction you need to go. That's why we call this the 65 Compass. Medicare is a journey. We need to be a compass. That's our mission. That's what we want to do. And we're here to help you. So make sure you set up that free consultation today so that you can get your bonus items that can be very helpful, but also talk to an agent that can guide you where you need to go. And then step three, this is my favorite thing about Brock Insurance. This is my favorite thing we offer. Once you have your free consultation and you make your Medicare decision using one of our Medicare advisors, we will become your lifetime agents. We also offer free lifetime billing and claim services. Going forward, we don't want you to worry about, do I get my ID cards? Do I have to take care of this bill that came in? I wasn't expecting this service to be charged. What am I doing? We're here for you. We're here for you at all times with those things. That's the difference between Brock Insurance and then another call center down the road that just wants to put you on a plan. We want to be here for you because we've been doing business since 1992. And we know that the best way to run business is to take care of people. And that's what we're here to do for you. We want to set up a free consultation. That way we can give you service for life. We want to take care of you. We're going to send you information on your birthday, on Christmas, just wishing you a happy birthday, wishing you a Merry Christmas, because those are the things that we want to do. We're going to keep you up to date with rate changes, all types of things that are going to make you feel wanted and appreciated as a customer. And then we also offer free annual reviews with our licensed agents to ensure you always receive the best match plan for your needs year after year. So those are your three steps, your call to action. Step one, Medicare education. You took care of that by showing up to this seminar, to this presentation. Great job. I hope it was useful. Step two, enrollment advice. Set up your free consultation immediately after this video. That way you don't forget. Set up your consultation. It's free. You can show up. We're going to get you more content to help learn, and the agent's going to be able to specifically talk to you about your situation so that you can make a great educated decision for your Medicare journey. And then the third thing is receive your lifetime support through Brock Insurance by becoming a customer, a client of ours. Let us take care of you. We're the Medicare experts. We are the T65 Compass. We're here to help you with your Medicare journey. Thank you so much. Have a great day. Can't wait to hear from you.